All right. How's it going, everybody? Sorry about the delay. Dr. Patel here with our patient coordinator, Lexi, and we are going to be going over a live demonstration of a shoulder ultrasound. So ultrasound, this is the imaging modality that's used to look inside the shoulder. Along with things like MRI and X-rays, this is a peek inside what's going on inside the shoulder joint. The shoulder is actually interesting. MRI is great at looking at particular structures. Ultrasound is actually more sensitive at looking at things like rotator cuff tears and biceps tendon issues, various different things like that. This can actually pick up a little bit more in terms of details with that. So we're going to get started. I'm just going to go through what the typical shoulder ultrasound examination looks like, and I'm going to go step by step, and hopefully you guys can visualize what I'm seeing on the ultrasound. So I've been taught that ultrasound is ultimately an extension of your physical examination. So I would start with doing a thorough physical examination, the type that we did last week on our Facebook Live and what we posted. And based off of that physical examination, I may alter the diagnostic ultrasound in one way, shape, or form. But I'm just going to go over the general structures that we're able to visualize with the ultrasound today. So first, we're going to start with the front of the shoulder and what's called the biceps tendon. So here we're looking at the front of the shoulder here, and you can see this structure here is actually the arm bone. Ultrasound, as a side note, ultrasound is actually sound waves that bounce off of different structures. And different structures have different densities, and the sound waves bounce off of different structures in different ways. For example, bone is bright white in ultrasound because all of the sound waves bounce completely off of the bone and back to the device. So everything below the bone, we can't actually judge what's going on there, and that's why ultrasound's not great at looking deep inside joints, because there's an issue with the sound waves actually being able to penetrate that deep. Other structures like muscle that we see here are darker. Other structures like ligaments and tendons could be darker than the muscle, but brighter than the muscle, but not as bright as the bone underneath. So what we're looking at here is the bone, or the arm bone there, and we're looking at the biceps tendon. So this round structure right here is the biceps tendon in cross section. The biceps muscle here becomes a tendon that attaches all the way inside the shoulder, and this tendon is now what we're looking at in cross section. So if you can imagine the tendon like a cylinder, we're now cutting that tendon so we can see that as a circle here. Above that tendon is the muscle, and what we do is scan up and down and see if there's any irregularities in that tendon, if there's any tendon tears. Other things we can see is if there's fluid surrounding the tendon. The fluid surrounding a tendon could be a sign that there's inflammation of the tendon itself, or it could be a sign that there's inflammation coming from within the shoulder joint, because as I mentioned, the tendon is continuous with the inside of the shoulder. Then I turn my ultrasound, and then I can see these fibers now going in this direction. Well, now I'm looking at the biceps tendon in what we call long axis. So now I'm looking along the cylinder rather than cutting the cylinder and looking at a circle. This is the tendon fibers themselves. And what we can see here is all of those fibers are all kind of parallel. They're all lined up. And this is why I describe tendons as being like the bristles of a paintbrush all lined up together, because you can see that those bristles are all kind of lined up and in a row. Okay? So from this position, I'm going to look at the first part of the rotator cuff. As we discussed in previous weeks, the rotator cuff is 4 different tendons that are almost continuous, come around and wrap around the ball of the ball and socket joint. And those tendon fibers, there's a part of the rotator cuff that's in the front called the subscapularis. There's one that's on the top called the Supraspinatus, on the back of the shoulder, the Infraspinatus, and then the teres minor underneath that. So from the biceps tendon, we can then look at the first part of the rotator cuff, which is right over here. So this again is the humerus, or the arm bone. This is what's called the coracoid process, which is a bone that sticks out at from the shoulder blade from the back. And this narrow structure here is the subscapularis tendon, which you can see a little bit clearer when I go like this. So this tendon, again, is tendon fibers are going in this direction and attaching onto the bone. And you can see how those tendon fibers actually travel underneath the coracoid process on the left side of the screen as I'm rotating the arm bone. From here, I go up to what's called the AC joint. The AC joint, you can see at the top of the screen here, is where the collarbone, right here, comes and meets the tip of the shoulder over here. And this is the joint, the space between the two bones is the joint. You could push your hand up for me, and you can see how that moves a little bit. Sliding off a little. Oh, I'm going to grab some more gel. Hope you guys can see this. I can't see the screen, so I'm only assuming that you can see this really well. I'd say to let me know, but I can't see the screen to know if you're commenting or not. So again, here's the AC joint. And if you could move your arm for me, you can see how there's a little bit of motion that takes place there. Now we're going to look at the major part of the rotator cuff, which is called the supraspinatus. So I'm going to have you put your hand on your butt like you're reaching for your back pocket, just like that. And now we're going to look at the major part of the rotator cuff called the supraspinatus tendon, and that's this tendon coming across there. Again, here's your arm bone, your humerus, and here are your tendon fibers going across, and again, you can see them somewhat parallel, going all the way across and attaching there. Now, what we see here is this kind of black line that's on top of the tendon. That's actually a little bit of bursitis, or a little bit of inflammation here. And this could be something that has occurred because of an irritation or an injury to the shoulder. This could be a normal amount of little inflammation that takes place after things like working out. But this is something for us to be aware of, because if Lexi has some shoulder pain, then this might be something that's a hint as to what's going on as a part of the picture altogether. So I look at the supraspinatus tendon and I go through from multiple different areas here, trying to look to see if there's any kind of tearing or tendinopathy or bursitis. And again, there is a little bit of schmutzy stuff inside the tendon here. So there is a chance that there is a little bit of irritation to the tendon going on. Now I flipped my probe here. So before I was looking at the tendon in this direction here, all the fibers parallel. Now I'm actually going in cross section. So now the fibers are actually coming at me here. And again, I'm going to look at the tendon at all different angles here and see if I find anything that could be irritated, something like a tear or anything along those lines. And again, we notice that bursitis that's sitting up top there. So from here, we go to look at the back of the shoulder and the rotator cuff in the back. So I'm going to have you put your hand across your chest like that. Yep. And now we're going to look at the rotator cuff tendon called the infraspinatus, which is on the back of the shoulder. Again, here's the arm bone, the head of the humerus, and here's the tendon fibers that come across and attach over here. This tendon is a lot thinner than the tendon of the supraspinatus, but it goes all the way and attaches over here. And we can track that down, it becomes muscle. And then as we go further, we can see the back of the shoulder joint right over here. So this is the ball of the ball and socket. This is the infraspinatus tendon or muscle that goes into the tendon and attaches over there. This is the end of the shoulder blade, which is actually the socket of the ball and socket joint. And this triangle right here is what's called the labrum. The labrum is that gasket or that thick rubber band that surrounds the ball and socket joint and provides stability to the ball and socket. And I'm just going to increase the gain a little bit here. Make this a little bit easier for us to see. Let's see here. Okay. So hopefully it's a little bit more clear. Again, here's the ball and the socket. If you turn your head sideways, kind of looks like a golf ball sitting on a tee or an ice cream on a cone. That's the ball and socket joint. And this bright white triangle right here is a part of the labrum. And what we're going to do is we're going to see how that ball and socket actually turns. As we rotate here, we could see that ball rotating on its tee, that golf ball rotating on its tee. And by doing this, we can analyze, is there any inflammation inside the joint? Is there an issue with the labrum? Is there some instability there? Has the patient had a history of a dislocation? We could see some things like dents in the golf ball or dents in the tee. A lot of stuff that we can look at dynamically from this regards. So those are all the major structures to look at from a shoulder exam with ultrasound. There are other things that we can look at too. There are ligament structures, there are muscle structures, there are nerves, various different things, again, depending on what the musculoskeletal physical examination showed is how I would determine if there's other things that I need to do with the diagnostic ultrasound. But as we saw, the ultrasound has its advantages over things like MRIs because it is more sensitive at looking at soft tissue structures like tendons. It has its disadvantages because we can't look deep inside the shoulder, although we can get hints at what's going on inside the shoulder with different views. But one big advantage of diagnostic ultrasound is that we can look at things dynamically. So you could see that as I was looking at the shoulder joint, I was rotating in and out, and I could visualize how the structures move when a patient is moving, not just static, standing still or lying down still, such as with an MRI or an X-ray. So overall, diagnostic ultrasound ends up being a very important tool in our tool belt in order to figure out what exactly is going on with a patient. When somebody comes with shoulder pain, the physical examination, the history, the diagnostic ultrasound, and sometimes other additional imaging such as MRI or X-ray, all together allows us to have the best diagnosis and then make the most appropriate treatment for that diagnosis. If you have a shoulder issue and you have concerns about what's going on, make sure you go to a physician that's able to do a thorough physical examination as well as an ultrasound, because I really do think that there's more that can be visualized than just with an MRI alone. And again, putting all this stuff together is how we can get you the most care. So I hope that all made sense. I hope you were able to see the ultrasound images. And I'll try to post some additional images and things along those lines in the comments. But if you have any questions or concerns, unfortunately I'm not able to look at your comments right now, but if you do have any comments, then please write them down. You can write a comment, you can DM, you can email us at info@fxregencenter.com. If you found this helpful at all, please like it, share it, and if you have any questions, concerns, comments, then please let us know so we can change things for the future or address things that you want us to address. Hope you all had fun. Have a great rest of your Friday and a great weekend. We will see you next week.